The next subject for discussion is schizophrenia. Schizophrenia is sometimes described as psychotic behavior. Lay people will describe it as that person is really crazy, meaning they're not really in contact with reality. We don't know the causes for sure of schizophrenia. It is probably a neurochemical imbalance. This is probably why some of the antipsychotic drugs, which alter the neurotransmitters, have some effectiveness for these patients. Patients with schizophrenia have some of these characteristics. We sometimes refer to them as the 4 A's. Associative looseness, meaning they have illogical thought progression. So they will go from one subject to another. They have very bizarre thinking. Now, affective inappropriateness. So their mood is inappropriate. They may be apathetic. Their mood may be inconsistent with their speech. So they may talk about being happy but act like they're sad, for instance. Ambivalence is the third of the 4 A's. And in this one, the person may simultaneously hold conflicting feelings. They may both love and hate the same person, for instance. This results in extremely poor interpersonal relationships. People that are schizophrenic have very few friends. They don't have close relationships with other people. Autism is the 4th of the A's. And autism means that they're withdrawing into their own internal world. So they may have delusions, which you remember are false fixed beliefs. I am the Queen of England. Hallucinations are sensory experiences for which there's no basis in reality. So people see, hear, feel, taste things that nobody else sees, hears, feels, or tastes. Ideas of reference mean that they think whatever is going on is about them and it is bad. Depersonalization means that they don't have a real concept of who they are and the boundaries to their own being, which is a rather a strange kind of thing. Imagine what it would be like to say, if I don't wear shoes, I don't know where my feet end and the floor begins. That would be a strange feeling, but that might be something that a schizophrenic would say. Now, some of the nursing care things that we want to do for schizophrenics. They may need assistance with activities of daily living. Frequently, schizophrenics, when they're having a major break, don't bathe. They may not eat. So they may need assistance with these everyday activities of daily living. We would want to provide for them structured but non-competitive activities. We don't want them to be participating in sports where there's winners and losers. This tends to make more aggressive types of behavior. We would like to try and establish a relationship, but it's very difficult with schizophrenics. You may be going to spend short periods of time with them frequently. So you may spend 2, 3, 4, 5, 10 minutes with them. You're not going to sit down and expect them to communicate with you for 30 minutes, particularly in the beginning of a relationship. So short, frequent contacts are best to help establish a relationship. Be sure when you talk to them that you use very specific words. You don't use any words that have double meanings. If you use words with double meanings, they are almost sure to pick up the wrong meaning of that. Be very specific, very clear, very concise in your communication, using very short phrases so that there's not a lot of things for them to remember and deal with. When the patient is hallucinating, the best approach is really to present reality. So if the patient is saying that they are seeing things, you say, I don't see these things, but I recognize that you do, but I don't see them. The only thing we really want to know about hallucinations, it's nice to know if there are voices telling them to kill themselves or somebody else. But other than that kind of information, we don't want to spend a lot of time focusing on the content of their hallucinations. When the patient is delusional, now a delusion is a false fixed belief. So they may have a delusion, a persecutory delusion, that people are out to get them. They're trying to poison their food, or that their wife hates them. If you directly attack the delusion, the patient is going to respond by defending it. And the more you defend something, the more you believe it. So we don't want to directly attack a delusion, even though we recognize it as a false fixed belief. But you might express doubt, what I call punching holes in this delusional framework. So if the patient says, my wife hates me, she really wishes I were dead, she doesn't want me alive, and you just say, I notice she comes to visit you every day. She drives 50 miles each way to come visit you every day. That's really strange behavior for someone who wishes you were dead. And then drop it. Don't continue with that point. You just expressed a little doubt in it. Don't argue with them about it. You'll never win an argument with a schizophrenic. And it will only reinforce their beliefs as they try to defend them. If the patient is delusional and has persecutory delusions and thinks that people are trying to poison their food, sometimes they ask questions about what's the nursing approach for this type of patient. One, do not become their taste tester. We don't say, well, I'll just taste the food. If it doesn't kill me, it won't kill you. Don't do that. The best answer is to provide individually packaged or canned food. So a container of orange juice or milk, but the individually wrapped or contained foods. Don't suggest that their family members bring in food from home, because quite often it's family members that they think are trying to kill them and poison them. So that's not a good approach. It's the individually packaged containers of food. Sometimes patients have illusions, and an illusion is a misinterpretation of reality. So they see shadows on the wall and think there's monsters there. They think there are snakes on the wall when they see a Venetian blind shadow. You should, if what they're experiencing is illusions as opposed to a hallucination, you should show them what happens, explain to them, and then turn the lights on bright so they don't have the shadows anymore. And that will take away those types of illusions. Let's take a look at a question. A client on a psychiatric unit looks in the mirror and cries out, I look like a bird! My face is no longer me. Which is the best response for the nurse to make? 1, what kind of bird? 2, that must be upsetting. Your face doesn't look different to me. 3, maybe it was the light at that time. Would you like a different mirror? Or 4, what makes you think that your face looks like a bird? The correct answer is number 2. Recognize the client's feelings. That must be upsetting, and then present reality. Your face doesn't look different to me. Now, when this patient says that, they look like a bird, the face is no longer me, this would be an example of that depersonalization that we were talking about when we mentioned the characteristics of schizophrenia. Another question for us. The nurse is caring for a young woman who is diagnosed with schizophrenia. She says, quote, the class is freezing with the igloo and Sasquatch Albany scooter, end quote. What is the most appropriate response by the nurse? What did you say? Sasquatch Albany scooter? Snap out of it. I did not understand what you said. Now, before I give you the answer, let me ask you, did anybody out here understand what those words mean? I hope not. Because those are made-up words. Those are neologisms. This is the client's own individual kind of language. So if you understand those words, we may have to refer you to a psychiatrist. For all the rest of us, we recognize that these are made-up words. So the correct answer is number 4. I did not understand what you said. This is one of the few times that you're not going to use that reflection, restatement type of answer. Because if you were to just say Sasquatch Albany scooter, the patient would continue with their neologisms, and we don't have any communication effectively going on here. So the correct answer was to present the reality. I did not understand what you said. Let's look at another question. A 23-year-old medical student is admitted to the psychiatric unit in a withdrawn catatonic state. For 2 days prior to admission, she remained in one position without moving or speaking. On the unit, she continues to exhibit waxy flexibility as she sits all day, neither speaking nor moving. What is the first priority for the nurse during the initial phase of hospitalization? 1. Watch for edema and cyanosis of the extremities. 2. Encourage the client to discuss her feelings and concerns. 3. Provide a warm, nurturing relationship with therapeutic use of touch. And 4. Identify the predisposing factors in her illness. Now, the question specifically said during the initial phase of hospitalization, and we're told that she's catatonic, which means that she either runs around in circles or she stays in one position. And we're told she's staying in one position without moving or speaking. So the priority then is number 1, physiology. Watch for edema and cyanosis of the extremities. This is an example of where Maslow wins again, as I often say. So physiology comes first. Note that they told us she doesn't speak, so an answer that asked her to discuss her feelings is not appropriate. I would not do a lot of touching to a schizophrenic patient. Many times they're going to misinterpret that touch, and sometimes that's enough to stimulate them to become a bit violent. So I wouldn't do a lot of touching with schizophrenic patients until I knew how they were going to respond to that. Another question for us. Mr. S is a man who has not spoken for years. He is diagnosed as having paranoid schizophrenia. One day when Miss J, another client, was standing facing the elevator, the man approached her from behind and reached for her as if to strangle her. What is the most appropriate action for the nurse to take at this time? Number 1, grab Mr. S's arm to stop him. 2, ask other clients for assistance. 3, say, Mr. S, that is not appropriate behavior. Or 4, get the client's attention and call for help. The best answer of these choices is number 4. If you call to the client and say, Mr. S, then he's likely to look at you and hopefully release his grip on the other patient. And remember to call for help. Every psychiatric unit has a word or phrase that when the staff utter this, everybody drops what they're doing and comes to assist. And you need to call that phrase. In the meantime, if you could get the client's attention, hopefully he'll release his grip on the other patient. You would not ask other patients for assistance, and simply saying that's not appropriate behavior is not likely to stop this patient from his behavior. If you grab his arm, this is likely to provoke more violence, so that's probably not the best answer for you. The correct answer was number 4, as I said. Now I want to take a moment and look at some of the antipsychotic drugs. The major category of antipsychotics that's been around for a long time are the phenothiazines. Now these are easy to recognize because they all have the word zine in their generic name and sometimes in their trade name. I don't know that you need to memorize all of the dosages, but just recognize that the different drugs have different types of dosages, so you need to be aware of that. The group of drugs that includes haloperidol, Haldol, Risperidol is another group of drugs frequently used for schizophrenics, the antipsychotic group of drugs. Now, side effects for these drugs: sedation. Any psychiatric drug is a central nervous system drug. Extrapyramidal effects, particularly causing the Parkinson-type symptoms, the shuffling and shaking. Extrapyramidal means it refers to balance type of things. Anticholinergic, the red, hot, dry, blind, mad type of side effects. Hypotension, so particularly they might ask a question if a drug is being given by injection, what should you assess? You need to monitor the blood pressure. So if the patient was getting Thorazine IM, for instance. They're very sensitive to light. They might ask questions about the photosensitivity. When you take a patient out on a picnic, make sure they wear long sleeves, big hat, keep out of the sun. And occasionally patients who are taking antipsychotics will end up with a granulocytosis, which is a drop in the white count, so they may have an infection that doesn't clear very well. This finishes our discussion of schizophrenic disorders.